Broadcast starts.
Greetings.
Yeah, 1 second, it's launching, so I don't miss anything.
Are we good to go?
Yes.
Now, good evening, everyone, and thanks for attending our 6th CamDocUK webinar titled Meeting the Community. Today, we're going to have a different format for what we always do. We always do have panelists speaking, but today we're going to have like a roundtable conference with 4 of us. And today we're talking about the doctors who had COVID-19 disease. As at August, or as at 2 months ago, the UK had about 620 deaths of their healthcare staff, health and social care staff from COVID-19. And recent count shows that we're about 13,000 infected or more. So it's been something which is disproportionately affected not only the UK, but the frontline staff. We knew that we were high risk anyway. From when we started losing the first doctors in March, I think Dr. Harami died in March. And before we knew it, the first 10 doctors who passed away were from Black and minority ethnic group. We knew we were in trouble. At that point in time, as well as we would learn as we go along, what we can describe what's happening here was simply chaos theory. We didn't know where we stood. We didn't know what was going to happen, but all we knew is that at that point in time, quite a few of our doctor colleagues and nurses were writing their wills, for we were not sure how it was going to pan out. Before we started, we were laughing and joking. I can assure you that in March, April, and May, we're not laughing and joking at all. And many of us who did not know we will be here now. Not being sentimental about it, it was as serious as it was. But thank God we're here. And so we thought we share that experience with the community. It's not gone yet, it's not done deal yet. As we'll find out, we are now emerging into a second wave of the problem. And we will find out as we go along how serious or unserious it is. But that said, today we're going to have, as I said before, we're going to have 4 panelists, 4 people talking. There's no moderator, all of us will be moderators. And we're going to try and share our story. We will also try and discuss the matters arising, what we felt at that period, and what we could share with our population. We will also try and pick up a few topics and talk about each of the 4 of us. Just some few housekeeping rules. We'll have 2 support doctors supporting us, Dr. Linda Bello and Dr. Anna Mbene. So if you have any questions, if you can put them in the Q&A section down below your screen, Dr. Bello will pick them up, and at intervals, we'll call upon her to say the trending questions, and we'll try and answer them. And that said, I will introduce each member of our team today. My name is Dr. Valentine Ngwa, and I'm the educational lead for CamDocUK. I'm also a consultant physician in elderly and acute medicine at the Mid-Yorkshire hospitals, particularly in Pinderfields Hospital. And the only lady amongst us in this panel is Dr. Montio Morgan. She's an ENT surgeon working down in Basildon, if I'm right. Dr. Elvis Ngassa is a transplant surgeon who was working in London, now moving to Manchester, closer to Yorkshire. So we're glad to have you in Yorkshire. And I've got Reverend Dr. Patrick Anochie, who is a stroke specialist in York Teaching Hospital. Now, Patrick is an adopted Cameroonian. He's a very good colleague of mine. As you see, I call him Reverend because he's also a Reverend in the Anglican Church. So when we're in desperate need of some spiritual help, he prays for us. I'm so glad to have each and every one of you here. And without wasting time, we will start with the first lady, the lady who was a former chair of CamDoc, and the only lady amongst us to tell us how your COVID came about and just give us the story.
Hello, everybody. I'm delighted to be here. Vali, you're a true gentleman, and in letting your gentlemanly attributes come through, you've forgotten that we had actually said Dr. Elvis Ngassa was going to go first.
Right. I changed my mind and I said, let me get the lady, but if you're happy, Elvis Ngassa can go first.
Sure, that's why I say you're a true gentleman.
Thank you.
Excellent.
Okay, Elvis Ngassa, you now have the floor. Thank you.
I will take the honor. I will take the challenge. Yeah, it's, as you can see, very emotional to talk about this thing, not from my personal experience, but also from what we saw when we were in the height of this crisis. Okay, Dr. Anna Mbene, I would try and share my screen so that I can go through my presentation. Anna, it looks like you're the only one who can do it.
No, you are good to go. You can share your screen.
Okay, let me try again. It's just saying no.
Oh, sorry.
Yes.
Yeah, sorry.
Sorry. While waiting
That's
for
done.
Anna. Okay, I'll
That's
try
done.
again now. Okay, fine. Good. Can you see it okay? Yeah, are you happy with that? Okay.
Yes, fine.
Let me go to the presentation mode. Is it okay like this? Yeah?
It's better on the presentation mode at
Yes.
Elvis.
Yeah, I'm trying, but yeah. Sorry. New computer, new technology, everything new. Anyway, I'll be talking most of it. So just bear with me if I put it in this mode, okay?
Okay.
Yeah, so I'm going to run through my COVID story, COVID-19 story. Yes, so I'll begin with a brief introduction, some sort of, outline what happened the last few weeks before I caught COVID. So the first week of March 2020, the number of COVID-19 related deaths was on a significant rise. Unfortunately, there was no social distancing nor any lockdown measures or plans yet. Testing also was very rare. Even with our inpatients, we had to struggle before we got them tested. But by then, Black people had finally come to realize that they were not immune to this viral infection. You can remember when this thing broke out, they were saying, oh, it doesn't affect Black people. Okay. To make things worse, the WHO's official position was still out of favor with the use of face masks. Most UK hospitals were short of PPEs, and hence hospital authorities limited their use. We were forbidden, for example, to use scrubs, let alone masks. By the third week of March, COVID-19 related deaths were on a sharp rise. And finally, the government decided to take some serious measures. On the 16th of March, Matt Hancock told the House of Commons that all unnecessary social contact should cease. And on the 23rd of March, Bojo in person announced the lockdown. So the UK officially went into lockdown on the 23rd of March. Well, regarding me personally, I'm just trying to trace how I caught this COVID. So on the 4th of March, I flew from London to Belfast to attend a national meeting. There were over 500 attendees. No one was wearing a face mask. There was no social distancing, neither at the meeting nor on the flight. At the meeting, we had just a few bottles of hand gels. So on the 7th of March, my wife and I, together with one other CamDoc member with her husband, I won't release her identity, unfortunately, it's confidential. We attended a Cameroonian and African music dancing contest, which we didn't win, of course. There was no social distancing, and unfortunately, it wasn't a bal masqué. Sorry, got some hitches there. Okay, fine. Sorry, just coming back now. Yes, so it wasn't the bal masqué. On the 10th of March, I traveled by train from London to Manchester for a meeting. Again, no social distancing on the train. Then on the 9th of March, I was on call for 24 hours. And I noticed that I had a dry cough, very strange sort of dry cough, and I was feeling feverish and very lethargic. Well, for the non-medical people, lethargic means I was feeling quite weak and tired. But upon all that, I was in complete denial that I had contracted COVID-19. The next day, I stayed in bed. I was very tired and I had flu-like symptoms.
Elvis, for some reason, your slides are not moving forward.
Okay.
Sorry.
Can go ahead and
yes. Okay.
Maybe stop share.
Yes. So I called 111 and unfortunately they wouldn't test me for COVID-19. I was instead advised, to my greatest dismay, to stay home for 3 days. Is it going forward now? Sorry. I will just continue telling the story, yeah?
Yeah.
So,
stop sharing so that we can focus on your story.
Yes. Really difficult. I don't want to cause other technical hitches. Sorry, Montio. Let me just.
Okay.
Yeah?
Okay.
So, these 3 days were extended to 2 weeks by the hospital authorities. Now, I was very lucky. My symptoms were quite mild, so much so that on day 3, I was already symptom-free and feeling strong. And so I decided to disinfect the whole house. I decided to carry out the disinfection mission. So I took a small bucket of water and added Dettol into it, but I couldn't sense the characteristic strong smell of the Dettol. So I asked myself, this Dettol must be expired. I was, So day 4, I wanted to go out for a walk. So I asked my wife to buy me a face mask. She went to the local pharmacist where she was told there was only one left and the cost was £2.
Wow.
So what treatment did I undertake? Just paracetamol for the first 2 days when I had pyrexia or fever. I had lots of hydration, lots of citrus fruits. And as I said earlier, day 3, I was already asymptomatic. That's without symptoms, apart from anosmia, which is loss of sense of smell. How did I avoid close contacts? Well, my main fear was to pass on these infections to my kids, as knowledge available was still very, very limited and treatment options were still under a lot of debate. So I stayed away from the kids as much as I could. I made use of my 2-pound mask and any type of face coverings I could lay hand on. I disinfected the home continuously with my odorless Dettol. Lastly, I self-isolated, did not go to work for 2 weeks, And most of all, I did not attend the CamDoc OGM, which was held on the 14th of March. That's more or less my story. Thank you for your attention. Thank you.
Thank you so much. Thank you, Dr. Ngassa. And
Thank
thank God you
you.
didn't attend the
Stop sharing the
CamDoc.
screen? Sorry.
Can you stop sharing your screen? I can stop sharing your screen now. Thank God you didn't attend the CamDoc OGM. Otherwise, I'm sure quite a few of us would have fallen. Well, quite a few people. I wasn't there myself. But thanks so much for your story. There are a few things that you said in your story we're going to pick up as we go along. And I just want our attendees to get a pattern of how the doctors themselves were being treated, so we understand what I mean by chaos theory. So he wasn't swapped. He was just told to stay at home and self-isolate. Dr. Morgan, is it your turn now? You're going to be the one telling me what to go now.
Absolutely.
It is your turn.
Absolutely, absolutely. And it's a real shame that Elvis was not able to go through his slides. And I wanted you to have the full benefit of Elvis's slides because they're absolutely fantastic. And also because he set the theme so beautifully with respect to the timeline here in the UK. So remember, Elvis said that lockdown was on the 23rd of March. So from the point of view of what happened to me, I'll tell you my story and what I call my COVID-19 chronicles. It all began at the beginning of March, when I flew to the States. I had planned to go to the States along with my cousin to go and visit our aunt who had been bereaved last year. And we had planned a whole Thelma and Louise type of journey where we flew into North Carolina, Charlotte, got a car, drove down to Atlanta, spent the night in Atlanta, and then drove pretty much a whole day to Hardy, Kentucky. So if anybody knows that side, the anatomy of that side of America, then it'll give you an idea of how large the distance was. But most particularly, there was no social distancing on the plane. There was no issues about wearing masks. There were some few people, but mostly Chinese, who wear masks anyway, and nobody was worried at that time. So this is between the 5th and the 11th of March. And the only time that I knew that there was something going on where I could be possibly exposed to something was on the flight back, where people were leaving the plane just before the plane, the doors were actually opened once or twice to allow people to leave the plane because they were not happy to travel to Europe because of the stories that they were getting back saying that they would go to Europe, they'd have to isolate, they wouldn't be able to come back and all that kind of stuff. So I fly back to the UK. I got onto the underground and came back home to Essex, Basildon, near Basildon where I live. And it was only the next week when I went to work that it's really sunk with me. The doctor that Dr. Ngwa told you about is my colleague, one of the first doctors to die. And by this time, he's an ENT surgeon like myself, and we were getting information that he was very ill on intensive care unit. I had personally worked with this doctor towards the end of January. And so things started looking really concerning at this time. I went to work. There was no issues. Well, between coming back and going to work, we had our the CamDocUK ordinary general meeting where we would normally meet and share something to eat. But in particular, this time we were doing our handing over of, or we were voting in our new executive and handing over. So it was very important that we met. We did all possible to have social distancing and to have hand hygiene, as was being advised by the government at the time. And those people who were worried that they might be spread, that they might spread the virus, did not attend, as Dr. Elvis Ngassa said. So I went to work the next week, and things went all crazy, because at this time, although Public Health England was not giving us any indications that this was what was going on. We were getting information from all sorts of places, from Italy, from other departments within the country, from my organization, my professional organization, ENT UK, saying that we in ENT were exposed. We needed to have PPE. We had none. I went out very actively to request for donations of PPE, which we were using within our department, but by this time it was too late. Even though we tried to go on to telephone consultations on Monday, the 23rd of March, when we had the lockdown, this was the day that we were getting fitted for our FFP3 masks. And at this episode, I am pretty certain that that is where I caught the virus, because we were all together in the theater room. The girl who was taking us, who was fitting us for our FFP3 masks was not even masked herself. Nobody really knew what was going on. And that week, I worked nearly all the hours that got sent in order to prepare for what I knew was the inevitable. And this happened on the Friday. Friday morning, I woke up with a blinding headache and a raging temperature. This lasted for about 3 days, my temperature, and the headache, the tiredness, the body aches. There was, even at this time, we were supposed to have a meeting with CamDocUK. I could hardly lift my head off the pillow, and I had to send in my apologies. Somewhere along the line, when I dragged myself out of bed to go in the shower, I realized I could not smell my African black soap. And I knew that that was the meaning. I had got what they call anosmia, or this lack of sense of smell that this virus affects. So in all, what happened to me? Luckily, because I knew I was at high risk, I had shipped my son away from home to go and stay with his sister in another city. So I was alone at home. I stayed alone for at least about 3 weeks. I monitored my temperature. I had family and friends bringing food and medicines and dropping at the door. I communicated with people by using the technology that we have. It was a tough time. What kept me going was partly, and in a great part, CamDoc, because at this time we were feeling how bad our colleagues in Cameroon were feeling, and we decided we were going to do educational videos. And so I would get up from bed and think, we have to do this video. I'd get up, have a shower, put on my lipstick, put on my my things, and do a video. Maybe it would take me 3 or 4 or even 10 times to get it right. But it was the stimulation that helped me. I think we're going to come back to other ways in which we managed, Vali. Is that right? But I'm sure that at this time, I might stop here so that I can give another person a chance to tell you how they got on.
Thanks so much, Dr. Morgan. Fascinating story. Well, I can say that now. I guess it wasn't fascinating at that period of time.
No,
but,
no, not at all.
I remember when you told me you suffered COVID, I was like, God. Yes, thanks.
Yes, and that's the other thing, you know, who to tell and who not to tell. You wouldn't believe that I never even told my mother. My siblings knew and they were supporting me, but we didn't even tell my mother. It was later on that she found out.
I can imagine the distress you would have caused her at that point in time.
Mm-hmm.
Thanks so much for sharing that story. And as you rightly said, we're going to come back to a few things that you said, because the support structure at that point in time was what kept almost all of us going. I think it's my turn now, and then we're going to come to Reverend last, because his story is very fascinating. Well, I can say fascinating now. I guess it wasn't at that point in time.
Mm-hmm.
So, as you said, we knew we were high risk from the beginning. I mean, we saw what was happening. We were not being allowed to use masks at some point in time. Even when we were using masks, were allowed to use surgical masks or the FP3 mask for patients who were high suspect of COVID. And so we had known that it's just a matter of time. Well, we prayed it wasn't, and but we knew that we were high risk. On the 3rd of April, I did come off work because I had applied for annual leave quite a few months before that. We didn't know we were going to be at this point in time. So 3rd of April, I came off annual leave, and by the Monday, I started out by feeling cold at home. I was just feeling cold at home. And I said to my wife, I don't feel all right. He said, well, you don't really feel cold sometimes. I said, yeah, I do. But because from February, I had known that I'm high risk, so I moved away from sleeping in the same room into my own quarters. She didn't know what was going on in the night. In the night, it was like I was fighting a battle. I was kind of anxiety. I wasn't sure if I was having delusions or hallucinations or what they were. But I know by the second night, I was not scared to go to sleep because I didn't want to feel the same way. I remember this movie, there's a series called Queen of the South. I actually watched the whole series because I didn't want to go to sleep in the night because that's how I felt. But during the day, after feeling cold, I started having an earache. I remember calling Dr. Montio. I said, well, this is the time where you phone a friend. So let me phone the friendly ENT, and I phoned the friendly ENT. And you went through my symptoms and said, well, I'll try to, as Elvis said something, and Dr. Ngassa said something we're in denial. I was also trying to deny that I could have had COVID. So I was trying to put it down to an ear infection. But when I spoke to you and you said, it sounds more like it's a referred pain from your throat, I just knew that this is where I was going. But by then I had been telling my wife, please stay away. I'm not sure what's going on here. If you're going to come 6 feet to me, wear a mask, just stay away. Because like anybody else, you're scared that both of you might fall sick and what happens to the kids at home. And you've been in a hospital where you've seen people go. And the thing about COVID is it starts mild. By the 7 to 10 day, when people start deteriorating, they're like downhill. So you're there waiting what is going to come. It was until the 3rd day when my appetite went that my wife actually believed that yes, something was wrong with me. And yeah, she thought, for this man not to like pepper soup, then there's something wrong here. And by the 5th day, I was so tired, like I could barely climb up the stairs of my house. And all the while, I was monitoring my saturations with a little probe I had. I knew that if my saturation goes down below a certain level, I'll have to call the ambulance in. And of course, you keep taking the things we've been taking before, all the supplements, or the zinc, vitamin C, the vitamin Ds. I will say this as well. I told my wife to make me a pepper soup with a lot of ginger and garlic and stuff. Well, it's a supplement. That's when you knew that. I knew that when you drown, you can crush a snake. I was doing everything that I could do to get better. At that point in time, the guy I shared office with, my colleague that I shared office with, texted and said he was in A&E and they've done his scans, and he texted the result of the scan. We got a consultant WhatsApp group in my department. When I read his text, I could feel myself being the next to go to hospital. And then 2 days after that, one of the other young one of the other guys in my department, also Dr. Khan, passed away. And so the morale was low. I remember the only person I could be talking with that time was my good friend in Leicester, Mr. Sapa. Just keeping the conversation going with him because I needed somebody to get me to distract me from that. One, you can't, even my elder brother, I couldn't call to tell because in America, how are you going to get here? One thing I was scared of was the cytokine storm. I was hoping that, if you could remember when Boris Johnson had it, it was by the 10th day that I now went to hospital. It was after the 10th day that I really could be reassured that the worst is over. But the only thing that could deal with me was the fatigue. I was fatigued all through, and I had to stay home for 2 weeks to get myself up, and then I went back to work on a phased return. So my symptoms were basically fatigue, loss of appetite for 1 day. I had a cough for like 2 hours. It was an earache, which was the throat pain. And when I went back to work, of course, I had to build myself back up gently. And that was when I could actually tell family members what had happened to me. So that's my story in a nutshell. There's something which has come out from all our stories, and I'm sure after Dr. Anochie says his story, we can be able to talk about those things, because the theme is almost being the same: how you distract yourself, how you protected family, and what the thoughts going through our mind was most important, really, because at a point in time, I'm sure most of us would have thought, I'm not sure I'm going to make this. At the point in time when I couldn't climb my stairs, I thought, this is where everything ends. And you can imagine how frightening that could be. Dr. Anochie, you're going to be your turn to say your story. And my God, I'll tell the attendees to brace for this story, because when I first, but just to say before, how I knew your story was when you put it on Facebook and you said, from now onwards, you try to be more kind than ever before, because you felt that God has given you another lease of life. Please, can you share your story with us?
Thank you, Dr. Val, my honorable friend and mentor. Thank you for the opportunity to be here with your team, which I'm adopted now to be a Cameroonian. No problems. One of my second godchild is a Cameroonian, so I'm happy. Now, being a doctor, first of all, the aim of this thing is for us to be educated on how most of us had this COVID, what we went through, and the second wave that is at hand, for us to just, know how to prevent and get ready and brace up for it. But we have to share our story. So we were very close. We were at the forefront of this. And, being a doctor, I treat patients, and most of the patients are elderly patients. And early then, I had COVID in April. So I had it later, last week in March, if I can remember when I started having symptoms. Then we're coming to work and we have patients in the ward coming with atypical symptoms. That's symptoms that are not typical of COVID. Confusion, that they normally come in with pain. We can't even find out the reason of this pain. I can remember on one weekend, we discharged 5 patients from the ward to nursing home, unfortunately. And on Friday, came to work on Monday. I saw the anesthetist one of my anesthetist friends in the car park. He said, "What are you guys doing in your unit?" I said, "What do you mean?" He said, 5 of your patients you discharged, all bounced back to hospital, battling for their lives, and all of them are now COVID positive. Some are in the ITU. I said, goodness me. Remember, this period, we were working without even a face mask. We are not even allowed a face mask then. Because the policies there were no PPEs, so policies were made around the availability of face masks. So we did the only PPE I had was wash my hands. My dark hands became very white because I almost washed off the melanin. That was the only thing I had, but as we could have it, we were just going. When I started having pains in my chest, breathing, being, the typical person we are, we always want to work hard. We ignored it. And some of my white colleagues, they smell of pain in their system, or they took some days off. But my colleagues, I'm not just exaggerating, but we kept on. Oh, somebody has to do this job. And then I became very unwell. On the 27th of March, that was my last day, Friday at work. I can remember feeling shattered. People that saw me say, "You looked awful. You looked," me while I was at work. I never believed I have anything apart from tiredness and that, Then one of the consultants looked at me and said, that work we said, you look very awful. If you feel this way, don't come to work on Monday. Meanwhile, one didn't believe me. She told my other junior colleague, if Patrick doesn't come to work on Monday, that means he's not a good doctor. Why I'm saying this thing is that this time around, nobody will make me do otherwise. That's why I'm highlighting all these things, and very important for us. Now, I went home. Normally, I live 1 hour, 40 minutes away drive from my home, 87 miles. So my wife and children are at home. I decided to self-isolate in the distant place. And then rang her, said, I'm not coming home to the house, but just help try and send food across. So she was sending food. She would drive up to Leeds and give my colleague that drives every Monday to work. Because I was out for 2 weeks. And they'll bring the food. And little did I know in the first week, I couldn't even, first of all, I lost my sense of smell. How did I know? I normally have this lemon. I bought lemon at Sainsbury's, lemon and the rub. You know, I put in water and just put towel over my head and inhale. Then one day I just realized I couldn't even perceive the rub anymore. But it didn't make sense to me till I used that same hand and rub on my eye. And I remember, look, I couldn't smell this thing, but it's now hurting my eye. So I now said, but you know, that thing in you will say, it's something else, it's not COVID. You know, but my appetite was going, my energy was going. I rang my vicar, you know, who is a doctor, a consultant as well, and we combined the spiritual and the medical. So he said, whatever it is, he was ringing me 3 times a day and we're praying together, and that kept me going. Then on the 2nd of April, I felt shattered. I was alone in the flat I rented. I'm moving around. I felt I'm going to drop here and it will be difficult for me to stand up. I was that tired. I wasn't eating. I was dozing on paracetamol 4 times a day and all those things. And then I texted the hospital, the clinical director, and he said, it's obvious you look as if it's obvious you have COVID. No need to come in, continue to self-isolate, stay away from your family. And if you need to come into hospital, give us a warning, we'll do. So 2nd of April, I drove my car to the hospital. When the nurses saw me, because that's the hospital I worked for 6 years, they were like, I was like a walking ghost. I know I wore almost all the clothes I had and jackets, and I was still shivering, the short distance from the A&E. But they checked me out. The first nurse wanted to swab me. Then the matrons came and said, no, you don't need to swab him. Just look out. And they did everything. They didn't test me. And I went home. 4 days after, this thing, remember my friends were cooking food because I'll tell them I need this pepper soup. Let me see if it's going to help. And they'll bring food and leave it at the door with like a long pole. And I'll come in and pick it, no contact. So I asked one of my friends to come and see me. He said, I said, please come and see me. Because then I was going crazy almost. 2 weeks without any human being. You know, that's another thing for me that I said, goodness me. You know, so this guy said, okay, I'm going to wear my N95 mask. That's the white mask. So he wore it and entered the flat with me, looked at me. As we were talking, I didn't know I was struggling that much. He said, Reverend, you need to be in hospital. I said, why? He said, because your respiratory rate, I counted it as 34. I said, wow. Remember, I didn't have anything in the room here. I don't have anything to check myself out. Hospital gave me paracetamol antibiotics I was taking, hoping that everything will be fine. You know, all thoughts came into my mind. I just prayed to God. I said, I have young children and I have a young wife. I don't want my children to grow up without a dad. It was that bad because you're seeing your life flashing in your head, in your face, you know. So I said, okay, let me call the ambulance. I called the ambulance. They say, is it life-threatening? I say, yes, it is. So they came in, took a look at me, you know, did their checks. My saturation was at 93, 94 on air. My respiratory rate was 33. You know, 33 means breathing almost like this without you knowing, you know, breathing very quickly, shallow breaths without you knowing. So I didn't know. So they checked my temperature on one ear, said it's 37.4, and they said, it didn't reach our cutoff. They checked this one, it was 39.9. I said, come on. So they bundled me to hospital. On reaching the hospital that night, I was admitted straight away, blood, chest, my chest x-ray. I was in A&E looking through, saw them running around to look at my chest x-ray because then my lungs are congested already. So I managed to call I didn't want to call my wife, but she always wanted a video call every time. You know, I can't hide it. So I called my venerable and he prayed for me. And he rebuked all the devil we can rebuke, which is one of the things that I'm alive today. And he said, just carry on, God is with you. And then he set up a round-the-clock prayer team for me as much as they can. And these were the things that kept me going. I went to hospital. They swabbed me the next morning. They kept me in a COVID query ward. That evening, they said, well, it's positive. I was lying down flat on my back. I can remember the consultant begging me, can you turn over, just a little prone like this? I have no energy to do it. That's how bad I was. I was lying down 18 hours in the bed. Everybody was watching me. My lungs were completely congested. My inflammatory markers were on the roof, neutropenia, anemia, name it. You know, so the consultant will come to my, 3 consultants came and reviewed me that day. The anesthetic consultants, I lectured with her, and she said, you may be going into ITU now, but one thing is sure, you will have a bed if you need it. And that statement is so strong because then we have 7 anesthetic beds, ITU beds, and there might be 10 people needing it at the same time. So to me, hi, that's the greatest favor she'll do for me. But, you know, it was that bad that people were coming into my room to put up a brave face. And they told me after, even up to last week, they were still saying, we are surprised that you are alive. We are surprised that you are alive. And I was on my sick bed, prayers were going on, I shed tears, I didn't hide it, you know, because I knew what was in front of me. And my wife was, you can imagine her position. And my children look at me and say, what's daddy doing? What's in his face? They don't understand the oxygen thing and, you know, why I had to be in oxygen. So I was in oxygen for like 3 days, and luckily, surprisingly to the medical team treating me, I started improving, because the story was like, those that were as ill as you are, they didn't make it. But I thank God I did. So that's my story.
So Lemon, we must say thanks so much. As I said, when I first heard your story, I'm like, wow, yeah, you went through. We thought we got it rough, but you got it rough, and I'm so thankful that you made it to share this story with us. And there are a few things. There are a few things that come up. Yes, Montio.
Can I? Yes. I mean, that story is just amazing, it really resonates with me, because the way I was during my illness, I mean, pretty much the same sort of progress. But the difference there was the support system, as what you had said. The difference there was the support system, because at home I had an oxygen saturation meter, which I put on my finger to monitor my oxygen saturation. And at some point it dropped down to 95%, and that is quite severe. But I knew that I had a very close doctor friend who was actually standing. It seemed like he was an ITU nurse for me, particularly, because he was in front of my house in his car, checking my ECG from the watch, you know, from the Apple Watch, because the support that I had from work. I mean, you said about this testing. At the time, when I requested to be tested, I was told no. Even the first test that I had it disappeared. They had no idea of what was going on. Things were so chaotic. I was tested for the COVID virus itself 3 weeks after I fell ill, and it was positive. And by that time, I was ready to come back to work. If I had followed the instructions of just self-isolate until your temperature has gone for 28 days, I would have been spreading the virus everywhere. Yeah. So thank you.
Yes, just a quick comment. I think among all four of us, Reverend Dr. Patrick really had the roughest time. I was particularly lucky because my case came in so early. I mean, it was before mid-March. I mean, it was just second week of March. And I was the first in my department. So there was no real experience, you know. So I didn't go through all that anxiety. Oh, am I going to die? Am I going to make it? Then to make things even better, I got well before the usual time you get the cytokine storm. Mm. Yes, but I remember when I came back to work, I was relocated to ITU, and that was the highest of peaks.
Yeah.
And at that time, 1 out of 2 patients didn't make it. So 50% of the patients were dying. So that was when I realized exactly what COVID was. So personally, my experience wasn't the worst, but I was lucky, well, if we can call that luck. I was privileged to see the most critically ill patients. Yeah. So Patrick went very close, I would say.
I was very close. It's so obvious.
Very close.
I think what is a few things are really coming out here, and that's just many people will think that those of us that work in the hospital, when something happens, we'll get the best of everything, isn't it? That's why I described it as chaos theory. It wasn't anywhere. I mean, I remember when I texted and I was on a phone and said, "Look, guys, I'm feeling unwell," and I was expecting this rush of like, right, okay, get an ambulance out to you, let's get you tested and everything. It was like, we can drive to A&E and get a swab. I can't even walk up the stairs in my mind driving to A&E and stuff. And then I look at it, I knew what treatment was available at that point in time, which was basically trial medication. So what's the point anyway? And I stayed at home. But so it's very important that people understand what was happening at that point in time in March, April. Medical staff were really not getting the best of care as we would have expected in this. In fact, if anyway, it was like, right, you'll see, okay, stay at home and see what happens to you. And the good thing about it is there's going to be a public inquiry into how this was handled. As I said before, 620 NHS staff died, and Doctors UK are actually insistent that they have to examine each and every one of those deaths. And I want to think that they have to examine each and every one of those infections as well, to say, if it was hospital acquired, then what are you doing with these people? The good thing is the medical examiners have now started in the UK since last year. So they're going to open up each and every one of those cases and take it to the coroner's court to be looked into. Hopefully we'll be able to have some answers on how things get quite haywire. We're always quite good sometimes to criticize African governments on how they handle things, aren't we? But I guess we saw chaos here back in April. I mean, not criticizing anybody here, but when your life flashes in front of your face, sometimes you think to yourself, if this happens, it happens again, or will I be able to take it? I think one other thing that we're saying, and we see that a lot in our population, just for them to know that doctors are also human beings. There was an aspect of denial in some of us when we started having COVID, to say, oh, we'll give every reason why this could be, could be earache, no, this could just be a sore throat, no, it couldn't be COVID. And we know that members of our community actually failed to get tested because they were scared that it could be COVID. So they wanted to deny. And I mean, it is nothing to be ashamed of. Even the past professionals sometimes get that fear as well. But the issue here is we as a community have to come together to see what sort of support structures we can give. Like Dr. Morgan just mentioned her support structures. Patrick mentioned his support structure. I mentioned my support structure. Without those support structure, we could have run mad. And that's one point we're going to talk later on. Quite a lot of mental health issues are arising now from people who didn't have support structures at some point in time in their COVID journey. Now, there's a question there, which I was going to take, whether we had antibody testing. You remember NHS went out to do antibody testing to all the staff, and all of us did antibody testing. And I think, Dr. Anochie, you donated your antibodies to, because there was, they were using convalescent plasma for COVID patients.
They were using convalescent plasma. I live in Barnsley, so I had to go to Sheffield to donate plasma to help to treat other people.
Yeah. I got my my antibodies tested. I think that was June. It came out strongly positive as well, as expected. Now the other thing,
can I just ask, the question here about antibodies is one, whether those antibodies can be used experimentally to treat other people, but whether those antibodies protect us. And I think the jury is still out as to how long the antibodies protect us for. So I remember just before everything went absolutely, before the proverbial hit the fan, I sent out on my WhatsApp status, I said, oh, I better get this COVID over and done with so that I can have antibodies and be protected, so I can go out and help and work and treat my patients. Now I'm thinking the second wave is coming, and we're going to be talking about this. I did have antibodies, but how am I sure that I'm protected? I'm not. So the story, the message here is continue to wash your hands and sing happy birthday for as many times as Bojo said, or whoever it was that said. Continue to wear your mask, continue to do the physical distancing, and remember that the best way to avoid COVID-19 is not to get it.
Absolutely.
Yes, sorry, coming back to that antibody question, I've got some colleagues of mine who, out of anxiety, took the test more than once, and it always came back positive. So my personal opinion is that those of us working in, the hospital milieu, we get continuously exposed and we produce antibodies continuously. It's just my theory, there's no evidence for that. Yeah, but from what I saw from those colleagues doing it repeatedly and having always positive results, my feeling is that we get bombarded and we react to it. Our immunity system reacts to it.
So you're suggesting that we are doing our own personal vaccinations?
Exactly.
It's one thing again. I'm not an immunologist, but it's one thing about the antibodies is it depends on the titer. So which titer is protective, we don't know. So and again, as Dr. Morgan said, the jury is out there. One day you hear this, next day you hear that, and it's just to be on the safe side, protect yourself. That's what we're going to say. And as we want to see with long COVID, even those who didn't have symptoms are coming down now with a lot of symptoms as well. As we're going to discuss. Now, there's something which I want to touch with Dr. Anochie was saying quite clearly. He's talking about the atypical presentation. The mainstream data, and that was one of the biggest mistakes I felt that we made in this country, and I'm sure Italy did warn us. The mainstream data will talk about cough, fever, sore throat, and then loss of smell and loss of taste came in April. And so we divided hospitals into green hospital, which are non-COVID, and red hospital, which are COVID. And but when people are older and frailer, we always knew this, that they come down with atypical symptoms. They don't come down with a straight type of symptoms. Even when they have a heart attack, if some people have heart attack, they got chest pain, going to the jaw and feeling impending doom. But older people will just come with confusion and falls and incontinence, taken to bed. This is because the frailty syndrome, geriatric germs from decades. COVID is no different. And that's what happened with the nursing homes. The patients will come in with COVID, but just coming with the diarrhea or the delirium, and they'll be sent to a non-COVID hospital, and then they will pass it around to staff. So like in my trust, the non-COVID hospital, more staff were infected there than the COVID hospitals as well. And what people see on TV most times are people in the intensive care unit with all those masks. Very few people got infected from the ITU because they were very well protected with all those masks. That was not happening in the wards. The wards were so different. You're having all these old people with those short of breath moving around confused and coughing in your face, and before you know it, have wards where 20 staff went down with COVID and stuff. So it was a very tough time.
It was that bad for us. In my ward, 14 staff came down. 3 of us were admitted. One pregnant lady, and she was in ITU, luckily, eventually. So another ward, 17 staff. But then they were saying, oh, non-COVID ward and COVID ward, which wasn't the issue with elderly people, because they were not coming down with the symptoms. There is general knowledge for everybody.
So the teaching is everyone is COVID until proven otherwise. Even swab. Even if you can swap your negative, swaps are those 60-70%, so you can miss up to 30 to 40% of the people. Everybody is COVID positive until proven otherwise.
I mean, one of the things you're bringing out of this is, let's remember, we're talking more about the hospitals, but I keep warning people, even when my wife goes out to shop, I said, remember that people that are stacking the thing in the shelves, they might be infected and spreading it there. So treat everything as potential infective phase, surface. You know, so in the hospital, remember, innocent patients were coming in. Some of them didn't even know. Even in the hospital, at some points, the staff-to-staff infectivity rates were high.
Oh yeah.
There was a case of a lady that came into hospital for stroke rehab, and she was in stroke for 1 month, no COVID. When she was going home, she now had COVID.
Yeah.
So obviously, the staff gave her COVID.
Absolutely, it's quite possible as well.
Let's bear it in our minds that these things are still prevalent, and in the face of this second wave, and we have to, you know, take it very carefully. Some people have not really tested themselves. They don't know whether they have the immunity or not. Like we are seeing here, those of us that have had this, yes, positively, we have immunity. You know, whether it's going to be protective, for me, with my faith, I believe it's going to be protective. I've been donating because mine has been very high, you know, because I was severely ill with it. So the titers were quite high as well. Well, they wrote me a letter saying the titers were quite high, but let us have it in mind. Because that's the essence of educating people, you know.
Thanks so much. You've touched on something there which is quite important. The second wave, we're going to come to that. So hold on that thought. I'm going to come to that. And I'm so grateful that your faith, the strength of your faith, saw you through. I think this is one thing in which I'm not saying people to go to whatever church or whatever, but I think that's the point in time where you actually discover your spirituality, isn't it? In my own case, that's one thing I found out as well.
Oh yeah.
When you realize that this could be just a few days left and stuff. Well,
you're very correct. I have a consultant friend who was ill with COVID before me, and he's completely an atheist. And I was sending him text messages, encouraging him in the Lord. And eventually I had it and I came out because I was that ill. I was 9 weeks off. I came back after 9 weeks and still struggled with long COVID. So he himself, the first day we met, he ran to me and said, look, Patrick, the text messages you were sending to me kept me going because it made me believe there's something there. And because of that thing I believed in, it helped my immune system. One thing I didn't tell you because I was conscious of my time. Remember, when I was ill, the way COVID was being treated then is if you're ill, you come into the hospital. They give you antibiotics they give for pneumonia. And they watch you and your system. If your God and your system wins COVID, you live. If COVID wins your immune system, you end up in the morgue. So there is no treatment. You say this is a tablet for COVID. When you go to hospital, it's just supportive treatment. That's why I say self-isolate at home. So let's not forget that. And that's where the prayers that I told you, my venerable, who kindly allowed me to be here today, you know, because we had programs clashing, but he believes in let's go out there and share what God has done. Absolutely. In this regard. You know, he said, look, 6 hourly prayers and a lot of staff. Permit me to say this. I had one very good friend as an ITU nurse. Whenever I tell him about God, he said, you're radicalizing me, leave me alone. He jokes about it. So she came to my room when I was ill, all gowned up. I said, Patrick, I know I've not prayed to that man there, but I've just prayed to him to save me and my family, you know? And so a lot of things came out of this. Thank you.
So good to know. And you also brought a very important point on long COVID. Again, hold on that thought, we're going to come to that because these are things we're going to discuss in the next section. And before we do that, can I bring Dr. Bello just to see if there are questions pending? Dr. Bello.
Yes, hi. Yes, there's been lots of questions coming through and you guys have been answering it as they came on. A lot of questions about whether you guys have had antibodies, which you've answered, and whether you're all doing fine. I know we're going to be talking about long COVID soon, so are you all doing well? Have you had any lingering symptoms? I think our attendees are concerned about you. Whether there was the UK government delays in implementing lockdown did not help the situation. wanting to know what kind of treatment Dr. Anochie got in ITU. So quite a few questions there. I don't know if we'll have time to answer 2 or 3 of them. And there's been quite a few that have been answered that perhaps you, some of the panelists that have answered could just touch on them as well for those that haven't had time to go into the Q&A box to have a look at the answers.
Well, the one posed to me directly, like I said, it was all supportive treatment. They give you oxygen, they give you normal antibiotics that are used in treating pneumonia, and they watch you to make it or lose it. And the survival rate was like 50%. So you can imagine 2 people falling ill and 1 coming. There must be something. Like myself,
the evidence for dexamethasone and remdesivir came in after that, isn't it?
After that.
Yeah. And I know some, like in my hospital, they were put on trial medications, including hydroxychloroquine at that time, but they were all on trial basis. They were not standard treatment.
Definite.
It was
so I didn't receive any trials, because I had it very earlier on before they come around to even think about what are they going to do. Then let me just take it on because somebody asked about long COVID. We're going to discuss it. Yes, I had, like I mentioned, I stayed off work for 9 weeks. First week, I came back. 4 weeks, I was reviewed by my GP. I can't even walk 500 yards without my heart rate jumping to 130 and my saturation dropping, so they were quite worried. I had no energy. When I started work, even 9 weeks after, on one occasion, I nearly collapsed because I moved in with full force. And they said, come. So one day they sent me home early. So I'm gradually building up my strength exercise-wise. And so, yeah, they're long COVID, but I'm better.
Thank you so much.
Can I take one of the questions, Dr.
Yeah, sure.
Yes, there's one political-looking question, and coincidentally, it's coming from my brother, Nicholas Ngassa, who is listening to us. So he's trying to say it looked like the UK government didn't learn anything from the terrible Italian experience. I studied in Italy, and I lived in Italy for 20 years. So I was following the Italian situation quite closely. And that's why I wanted to take that question. So what was most shocking in Italy were instances where the ITU doctors had to choose who to put on the ventilator. Yeah, they're terrible stories, not rumors. We were getting the stories from our colleagues in Italy, guys we worked with when we were studying in Italy and when we were practicing in Italy. So they're true stories. Yeah, there's one story, for example, where a reverend priest said no, he was not going to, that they shouldn't put him on the ventilator because there was a younger patient nearby. Put that young man and leave me alone. And he died, but he saved the life of the young man, for example. So coming back to the UK government, I think the UK government was too frightened about this extreme event which happened in Italy. So they got over-prepared to face the critical situation. You remember the Nightingale Hospital with, 6,000 beds? They were never used. They were never used. So if we had come to that situation like in Italy, where you had to intubate a lot of people, we wouldn't have ended up in a situation where you choose who to intubate. But so the UK government, I think, was too focused on the possible critical effects of COVID, and they almost completely forgot the basics, like testing people. So that's the way I say it. Yeah, it's not that they were negligent, but they were over-prepared to face the worst, and they almost forgot the basics.
Yeah, thank you. As you're right, you're quite right there. I think they did prepare quite a lot on a big number. I remember in my hospital, they already booked hotels that they're going to move all the doctors to stay in there and just run around the clock and stuff like that. And they've already marked some car parks to change. There's going to be a public inquiry, I presume, after all this is done, so we can learn lessons there. But again, that was a very good thought. And that said, we're going to enter into the second phase of our conversation. We will be taking some more questions later. And that's this, we're going to be discussing, give each of us some time to discuss on a few issues that are coming up strongly these days. And the first, and I think Dr. Anochie talked about the first, was long COVID. Just give a short preview on our attendees what long COVID is. So when the COVID pandemic came in, we imagined, or we thought that you're going to be ill for 2, 3, 4 weeks, and that's it. You get better and you go back to work. But unfortunately, it's not so. We're seeing people who are being sick and having symptoms 3 weeks and above, 9 weeks and above. People having symptoms for months. And then in the UK, there was a study group. There was an app, which was a COVID study app, that could track people's symptoms. And they could say that about almost 1 in 10 of people who had symptoms were having symptoms prolonged for months. And the worrying thing about that was that even people who had very mild symptoms, who were not tested, even people who didn't get to hospital, and even people who didn't even have symptoms are coming down with symptoms of long COVID, and they're quite varied. Let's remember, COVID is a multi-systemic problem, so it can affect almost every organ in the body. So too is long COVID. And why does that happen? There are a few postulations that why that could happen. One, that people are having persistent viruses in their system because they're not able to mount a very strong antibody response. People are, the second one is the fact that people could be having an autoimmunity. So your body starts fighting yourself. So the virus triggers your body to produce chemicals that start fighting its own self. And people are also thinking that it could be an element of people being deconditioned. So be at home or be on the bed for quite a while, and you lose muscle strength. So this manifests in quite a few ways. There's more shortness of breath, more cough. Remember, we talked about loss of smell and taste. Some people are having that persistently, carrying on. Muscle pain, joint pains, and most importantly, people are coming out with mental health issues as well. People are coming out with a condition called brain fog, where they found out that they can't really engage in executive tasks to think, maybe you're doing some financial manipulations and you cannot focus on it anymore. People are coming out with things like that. It's a whole range of things. There's a study at the moment to actually situate it. The symptoms don't vary with the age as well. And worrying are the people who are in the working age category are coming down a lot with long COVID symptoms. So the median is about 45. So you can imagine somebody who is 42, for example, who had the mild COVID symptoms, cough for 2 days and fever for maybe 1 day and then got better, but now coming with prolonged fatigue, and it could be relapsing and remitting. And then imagine you didn't test them, so you didn't know whether they were swab positive or not. So it's becoming a big issue now. And to make it worse, there is no guidelines on how to manage this long COVID yet. The UK government has just commissioned NHS England and National Institute of Clinical Excellence by the end of October to try and come out with some guidelines on how to manage COVID. And they've put some millions down to see how we can really streamline this. But let me talk about 3 organs that are worrying with long COVID. The first is the brain. We know that it could affect the brain, and we've talked about brain fog, but people are coming down with flourish psychosis. People who were young people, there's a young doctor that I know had mild COVID, but now is in a psychiatric hospital with flourish psychosis. People are coming out with epilepsies and stuff. Again, let me not scare people with this. It's rare, but it's happening. The most important is the heart. As we said, the virus could affect the heart, but also because of the autoimmunity, the heart muscles could be inflamed. So there's a condition called myocarditis. For those who are not medical, the heart has got different layers. The innermost layer is the endocardium. The muscle, the thicker one, is the myocardium. There's a thinner layer called the epicardium. Then there's a stronger layer called the pericardium. People are coming out with inflammation in the pericardium and the myocardium. And that's a very serious condition because the heart is as good as a pump to pump blood around. But that pump mechanism depends on the electrical activity of the heart. So if you got the heart muscles inflamed, 1, you could have a distorted electrical activity of the heart. 2, we're not quite sure how it's going to happen long term. whether they're going to affect the structure of the pump mechanism of the heart or not. That is under review. But there is a warning at the moment that those who are very athletic, if they've had any involvement, should pace themselves, not extend except for the first 3 months, and then try and build that up gently, hopefully with some professional help as well. Then the next is the lungs. For people who have had lung disease, you could have the lung going into like a fibrous, what we call fibrosis, so it makes it difficult to expand for you to breathe normally. We are, at the moment, then, as I said before, there are no streamlined guidelines on how to manage these things, even how to diagnose it, even how to say, at what point do you say this is long COVID and this is not? But it's important that those who have had this condition should know that help is on the way. It is not just me trying to frighten people. The NHS is trying to put a lot of resources in place and put these specialist clinics that people can actually access. So if you cannot get to your GP, because I can imagine sometimes it can be hard to get to your GP, there are resources which CamDoc will put on our website. There are a lot of them that you can visit. And one, you can visit and use that to pace yourself, so how you build yourself up. Two, you can visit to see how you get help. I think CamDoc will be trying to involve in that peer support as well. The support structure is extremely very important, particularly for those who are developing some issues with stress, with depression, and it can be that support structure to signpost you where you can get some of this help. And at the moment, the good thing about COVID has done is COVID has formed this collaborative work between most community doctors all around the globe. So we're hoping that we should take this further as COVID is developing into a field that we're beginning to understand better and provide those support structures. There used to be 3 things in which medical school I always think that could cause you anything: TB, sarcoidosis, and syphilis. We're at HIV in the midst. Now, COVID is the 4th thing that can cause any and everything. So long COVID, we're still learning it, we're still knowing it, but the advice to young people is prevent yourself. Don't say, oh, I'm young, I can get it, I'll get over it just now, because you don't know what it can cause you in the future. Thank you. And after saying that, I think we will go now to Patrick, who would, sorry if I call them on by first name basis. We're kind of friends, all of us, so we kind of like first name basis sometimes. So you just, the attendees should bear with me. The second wave. Are we in the second wave now, Dr. Anochie? If you can tell us about the second wave.
Yes, thank you once again, Val. Yes, I have to emphasize this because we've heard about it. Some people are a bit confused. What's going on? Many people are not dying as much as they were dying earlier. This is that. But officially, UK has entered, from the number of infection diagnoses that have been made and hospitalization and deaths, UK has entered into the second wave again this September. So, you know, from 15th of September, things have started, numbers of cases have started rising again. Even though you can attribute that to more testings being done, but we are seeing more hospitalizations. At some point in my hospital, there were no COVID patients for like weeks, but now the numbers are rising, more wards are expanding. So we are officially in a second wave. I need not, you know, spend so much time on this, but the essence is for us to understand why are we saying we're in a second wave. You know, the R number that are being used used to advise government when to, you know, for a long time when the lockdowns were eased, the R rate were between 0.9 and 1 or something like that, less than 1. And what R rate simply means is the number of infectivity. One person, the ability to infect another person, you know. So if one person is infecting another person within 3 days, then that means in 1 week, there'll be like multiple of 2. But if the R wave is elongated, you know, by shortened, that means one person infecting one person in 7 days, you know, then the R wave will remain low. So just to give us a bit of an example, what it's all about. And that's the figure the scientists used to advise government. Say, look, the number of people infecting each other are rising now. It's getting shorter and there's trouble. Like somebody asked earlier, did UK act very late since they saw the warning for England? And that's why you're having local lockdowns now. Because one of the ways is to stop all these things is if I don't if I have COVID and I don't infect somebody else, if I don't go out, then the chances of me infecting somebody else is less. Then the safest way to stay away from infectivity is everybody to be at home. But you know, the government have to balance it with economy. People, are they going to be at home and, you know, and die of hunger, not eating and not paying rent and all those things? They have to balance it. So it's very difficult now. But the message here is UK is officially in the second wave and effectivity is rising. Another controversial question is, why are we not having the peak deaths we had? Well, we used to have like almost 1,000 in a day. Now we're having like less than 30, 40. I can't remember the last time for, you know, what it was yesterday. But the infectivity rate numbers are rising from 75 when we are, you know, things we are betting to like 20 something now thousand every day. So we have to be worried. And our own beat, if we remember that we dark-skinned people, BME, were badly hit by this, I think we should be the ones to be listening to things. And one of the things I highlighted when I first spoke to my alumni in UNN, that's University of Nigeria alumni group, I told the doctors, now, this is not the time to start taking extra shifts. You have to be wise. This is not the time to, you know, when others are running away to shield and stay at home, you are seeing it as an opportunity to take extra locum shifts and go and make more money. You have to be alive to enjoy this money. You have to be alive for your family to, you know, enjoy this money with you. Those that passed away, unfortunately, whether they are being paid 60,000 per family, it doesn't make any sense to them. They're better off being alive than do this. So we are officially in an R wave, and please, even when they say youngsters are more affected, please don't be offended. If you see what's going on in the universities, you know, is in Newcastle that had 1,000 students testing positive. And on one occasion, I can listen to them in BBC being interviewed, and the youngsters were saying, well, we need to go out and party. That's why we are here in the university. No, this is a pandemic. It's not like 2 years ago when you come into university, you're free to socialize. No, things should be handled differently. You know, because of time, I have to stop and wait for questions. Thank you for the audience once again.
Thank you so much, Dr. Anochie. Thanks a lot. And I think you're right, the numbers are rising. I remember 3 weeks ago, my hospital had about 6 COVID patients, or 2 or 6. As of yesterday, we had 51, so they're climbing up. And more worrying, we're having more younger people nowadays. And we're having more sicker younger people. I mean, there's a 26-year-old who's quite sick in my hospital as well. And when the older ones are coming in, they're coming in very, very unwell. Mm-hmm. There was this speculation that they mutation of the virus and is more infective but less virulent. Nobody knows. I would say no speculation. Just be protecting yourself as much as possible. Nobody knows. Dr. Morgan, you did have COVID. You did want to find out whether you did prepare for COVID. You did expect you were going to get it, and if so, how were you preparing to get it? Don't forget, we're getting a lot of people now. With 13,000 a day is a big number.
Absolutely.
So some people are invariably going to get it. When I was working one time in my hospital, yeah, go on.
No, go ahead.
One time I was working, you remember the NHS, when they started, the government wanted to just let everybody have it. So shield some people. So let people have it. So I saw on the news, prepare for COVID as you will prepare for surgery. I'm like, oh dear. Okay, so how are we preparing for COVID?
That's a very, very good point. And I think a lot of the time it sounds rather cheesy, but if you fail to prepare, then you're preparing to fail on a lot of things. Before I go on to that, actually, I just want to underline the issue about long COVID and how things can change for you really very quickly. Personally, I'm a very upbeat person, and I could not believe that I was faced with burnout about 2 to 3 months after I had COVID, and I had to go off sick. I never go off sick. I mean, last year I had a back operation, so I was off sick, but that was because I was flat on my back. But nothing stops me from going to work just because I am being stressed. But for me to take 2 weeks off work for stress, then it really means you have to really take this symptoms, the psychological effect on us. We really have to take that into consideration. When it comes to preparing for COVID, I want to say, first of all, that let's not get really out of context. Majority of people will get COVID, as we've said. 85% will get a mild episode of COVID, and they'll get better, like Elvis did. We're now seeing people developing long COVID, and that is affecting things, as Dr. Valley said, psychologically, physically, affecting their ability to make money and to put food on the table. So in order to prepare yourself for coming out of COVID with the best chances, inform yourself. First of all, have those conversations with your family. What is it? Who is it that could possibly be more exposed and more vulnerable? And shall we shield them? Shall we have these conversations about keeping certain people away? Remember, I took my son away to go and stay with his sister in preparation. So that was my family circumstances. I got myself a finger probe to check my oxygen saturations. I got myself a thermometer. Some of us don't even have a basic thermometer at home. I've got a fever. Is it a fever? Is it not? Get those things. Stock up on some vitamins, vitamin C, vitamin D. Take them every day. Build your body up. Go out for a walk regularly. Take exercise. Build up your lung capacity. Go out in the fresh air. Make sure that your body is stronger, more immune to anything that you can possibly come up against. It sounds maybe really very very basic, but our grandmothers, they used to do things to make themselves that made them strong and resilient. Why don't we go back to these things? Do breathing exercises in order to improve the elasticity of your lungs. COVID affects the lungs. I did some yoga exercises which helped me develop the strength and tone of my lungs, so that that becomes more elastic and more resilient. Now, we've spoken about increasing your fitness, mental support. Are you going to listen to music? Are you going to listen to audiobooks? Are you going to read when you're having a horrible temperature, lying in bed and you have a cough and all of those things? You may not want to read. Make sure that you have your Spotify playlists downloaded so that you can listen to them. Know who you can call on when you just want to have a chat. If you have some friends in America who are on the other side of the time zone, then maybe you will call them instead of the people that you normally call. Discuss communication. Make plans. Talk to your family. Where is it in the house? If you work normally with people, if you go to a hospital to work, or you go out to other places where you are going to be exposed to this, make sure that you know where you take off your work clothes in the house, go upstairs, have your shower before you have a contact with the family. Practical things like this. Discuss, what if you have to go into the hospital with an ambulance? What's going to happen to your family? What if the worst happens? What if you die? We don't like talking about these things as Cameroonians, as Africans, but have these conversations. What's going to happen if the worst happens? We do have support within our community, and these things exist. We just have to think about them. Awareness is key. Now, one of the things that I found supported me was ability to be in communication and contact with people, even while I was ill. Because at the time, I'm one of those people, if you give me an opportunity, I'll talk until the cows come home. So, you know, I was getting phone calls from people and I was doing advocacy. Among CamDoc members, a lot of us are here for our community, happy to do advocacy. Make sure if you don't know one of us, make sure you can contact somebody who knows somebody, you know, that they can just speak to them. You can speak to them. We have lots and lots of nurses within our community who can provide you help and advocacy as well. If you call 111 and they just ignore you, call one of us, talk to somebody, help. Sometimes you just need somebody to talk for you, to be your voice. We, CamDoc, are here to be your voice. And I would say that we are developing that, even though so far it has been more of an informal service, a community service, but we are developing that. This is part of who we are. We are community. CamDoc is community, and that's why we're talking to you, and we're hoping that you're talking back to us. Now, finally, prepare yourselves for COVID by avoiding COVID. Prevention is better than cure. Thank you.
Very well said, Dr. Morgan. Very well said. Thank you so much for that. And you're quite right. I remember, as I said before, when I was down with mine, I thought, I need to phone a friendly ENT to sort me out. And I guess some of those communications, that network does keep you strong, isn't it? And I cannot emphasize that any much more of that. If that's what we need to do for our community, I think that will make our job worth the while, and that we form that support structure for our community in these very difficult times. And you said prepare. I've seen older people come to hospital in COVID without being prepared. One thing in which the government did was give us guidelines. If you are 65 and above, and you've got a clinical frailty score of 5, so you're needing some help at home, maybe a walking stick, or you need any carers at home, no ITU for you. But many people didn't know that. So the moment they hit hospital, they have to put those plans in place, ward level care only. And so they were not prepared for that. The family were not prepared for that because they hadn't had that conversation. They can't come to hospital to see their family members. They have to get a phone call and they are shouting down the phone and like the rules. That's something we should have talked about before you get into hospital. But yeah, planning. And as I said before, many doctors realized that they had to write their wills because to realize that, hang on, this could not be what we expect it to be. Now, Dr. Ngassa, you did use, what was it used again? Dettol to prevent the house. So can you just tell us how, if somebody has got COVID at home and is self-isolating, how should they prevent other members of the house from picking it? Because that should be a very big concern. You don't want to, we know of people who gave it to their partners and both of them were very sick. You don't want that. So how would they prevent themselves from passing that virus over to household members?
Yes, nothing, different from what we've been hearing on the TV and elsewhere. So we just need to re-educate ourselves. I mean, COVID cases reduced and we forgot the good habits we had learned. So the 3 basic preventive measures, we talk of maintaining 1 meter social distancing, and where this is not possible, please wear a mask. Well, at home, 1 meter distancing is almost out of question, but at least you can make it up with a mask by wearing a mask. So we also remember, cover a sneeze or a cough with a tissue or a bent elbow. We all remember these things. It's just to come back to those basics. So if you cough on the tissue, make sure you dispose of it in a closed lid bin immediately. So avoid touching eyes, nose, and mouth. Wash your hands frequently. with soap and water, or if you don't have that available, use a sanitizer. Then I will also like to call the attention of everyone to the World Health Organization's 3 C's. So the first C stands for spaces that are close, so closed. Second C, crowded, spaces that are crowded. And the third C is spaces which involve close contact. So those 3 C's, if we can avoid them, that's going to make a big difference. So, and if you look at it well, those 3 C's are present in places like restaurants, fitness classes. I'm just trying to hesitate to say what's on my mind. I wanted to say in the church where, you know, there's choir, there's choral singing. Yeah, singing is a very aerosol generating process. And we know that's the main way COVID is transmitted. Yeah, so coming back to your question, in, let's say, the home environment, another very important thing we could do is keeping the windows open to ventilate. All basic things, but very important. And clean and disinfect surfaces, as I was doing with my Dettol. And you know, the most important soft surfaces are the ones we touch most, like door handles, like taps, and you know, our mobile phones. They are one of the worst vectors of whatever you can imagine. Then, to conclude my answer, I'll come back to the mask. So, all of us have seen things like this. So this is absolutely rubbish and useless. Then, worse still, you find people going around like this. It's just ridiculous. Please put on your mask properly. And remember, the WHO says, disinfect your hands before putting on your mask, and you disinfect it again after putting it, you know. And then when you're removing it, disinfect your hands, remove it, and disinfect it again. Because, of course, once you've worn it, it's no more clean.
Yeah.
So those basics, they count a lot. So avoid touching eye, nose, and mouth. Put your mask on, disinfect surfaces, and keep social distancing. Thank you.
Thank you so much.
Can I just come into that? I mean, it's really very interesting that you see these WhatsApp pictures with different ways that people can wear their mask on, hanging on one side, hanging on here, on the forehead, or under here, and so on. But the main reason, and I am always very curious, why? Why is it that people wear the mask just underneath the nose and just covering the mouth and leave the nose? It's because it is not fitting properly. And when you talk, I have one of those very African stroke Chinese faces where the nose is not prominent. And so when I talk, the mask comes down. So what I do is that if I wear a mask and I know that it has to be in place all the time, I'll put some tape over the cheeks here, just at the top, to prevent the mask from coming down. So thinking about these little practical things is very important. The other thing is, because we are very used to seeing our mouths working, and we want people to see us talk, not just hear us talk. As an ENT surgeon, I deal with people with hearing loss. Then not being able to see the words enunciated does cause a problem. So there are different sorts of masks that you can use if that's the problem, that have a clear part in the middle that we can use if that is an issue. So thinking about just going past the little step, why is it that you're hanging your mask on the one side? Is it a fashion statement? Is it that it doesn't fit and so it keeps coming down? Is it that you want people to see your face when you're talking? All of those things. Remember, the mask is there for protection. So looking at how to optimize the use of the mask is very important.
Can I add something there?
Yes, absolutely.
Yeah, when Dr. Ngassa or Elvis was talking, you know, about disinfecting and putting on this mask, doing this thing, one of the simple things I do now is that in my house, I have 2 big jars of hand sanitizer. I do get some people coming here to teach my son, piano, and somebody. You have to disinfect your hand. Then in the car, all our cars will have little ones. So, I mean, those little, because I take my children out, and before you can say jack, they are rubbing their whole hands, the whole rail going up. They don't even care. They don't even know what you're talking about, and they are coming to the car. So I just have it at times. I have it in my pocket. We're going swimming and say, come on, take this and rub. So little things like that. We can buy these hand sanitizers. They're not expensive. I think the recommendation is 60% alcohol content on it, so you'll be sure it can kill. So I just wanted to add that.
Yeah, thank you so much. You're right. So because sometimes you just need 5 seconds of lots of interest, and then you won't believe that even after what has happened in the UK, some people still don't believe it that it exists, do you? I mean, I was in same-day emergency care last Sunday, so 6 days ago, and I got this young guy from this Caribbean guy walked to my consultation, and he had his own mask down here, and he asked me, "Is it COVID thing for real?" I'm like, well, my question was like, "You kidding me?" So despite the fact that you've seen thousands of people die in the UK, some people still believe in all the 5G something, isn't it? Which of course we're not going to comment on that, but yeah, some people still are not getting the whole point, and those are the ones who will be the sickest when they get into hospital, and when they get in, they'll be screaming for everything to be done. And well, so I think we would take some questions now, but before we do that, let me just remind our attendees that we always have a survey just to make sure that we're delivering the kind of things that you would want us to do. If you could take a minute to respond to our survey, there's a link being posted. Respond to the survey, that'll be very, very helpful. And with that, after saying that, can I bring Dr. Bello if there are any questions for us to take?
Val, please, can I plead with the audience that because I have a program clashing, I'm like,
oh yeah, we said something
15 minutes late, please. I'm
thank
happy to
so
be here.
much.
I would have loved to be here to the end, but I have another, church program going on, which my vicar allowed me to attend this one. So
Oh yeah, no, I understand. Thank you so much, Reverend. You've been quite kind to attend. Thanks so much. We do appreciate you being here.
All right, my pleasure.
Thank you so much.
All right then.
Okay,
take care. And you too. God bless all. Bye.
Yes, there have been lots of questions as before. You've been answering some of them. There's one for Dr. Morgan, which she's going to answer in a minute. And we have some questions about traveling. What would the panelists advise about traveling? Are reusable masks effective? And what about shields? Do they protect as well as the face masks? And I think I saw another one in the chat. Very interesting one here for Dr. Ngwa. Do we know whether people with pre-existing autoimmune disorders are more prone to being severely affected by COVID? And they're asking just because you mentioned the possibility of an autoimmune reaction for those with long COVID. So I think that's enough questions there for you to take us to the next round.
Yeah, thanks so much. Just going to the autoimmune problems, I think they're one of the problems that are being shielded in the UK at the moment. People with autoimmune problems, quite a few of them. I mean, autoimmunity is a very wide disease spectrum, but quite a few of them are being shielded because they are vulnerable members of the public. That said, let me just bring forward the concept of age. We know age is chronological age, mental age, and physiological age. There's an other type now called the COVID age, where depending on your ethnicity and your comorbidities, you could actually be chronologically a 45-year-old man, but for COVID age, you're 70. That's because they could add those autoimmune problems, high blood pressure. If you're a Black person, you have, I think, 10 years added to your age. If you're a woman, you have 5 years subtracted to your age. So yes, those things as well do increase your risk. But the underlying thing is that everybody, if you've not received a letter from the government telling you you're vulnerable, contact your GP, who will risk stratify you and put you on the category that you belong, whether you should shield or not. It's very important that everybody has that classification. In the NHS, all the occupational health departments do contact the staff and do a risk categorization. When it came out that blacks were dying more, they had to risk stratify all the BAME staff, were a majority of them. And some people were actually sent out from the wards onto other places to try and protect them. So if you got any autoimmune problems and you've not received a letter from the government, whether it's to shield, please contact your GP and let them classify you. Thank you.
Yeah, the other thing was about face shields. I mean, there's been lots and lots of suggestions and discussions about whether face coverings and face masks and so on. Remember, these are to protect other people from what you are coughing out. So if everybody wears a face shield, then we are all protecting each other. Some of them protect more than others, you know, but this is information which is very, very, very easily available. The best thing, as we always come back to, is preventing. Did anybody have anything else to talk about face shields and reusable face masks and so on?
Well, I think those that are meant to be reusable are protective, but those that are single use, if they're reusable, they're not protective, and that's one of the problems. But you rightly said it is meant to it's mostly to protect the other person. So if both of you are wearing it, then the chances of any aerosol of any droplet exposure is lower. Again, it has to be the right type of mask. Unfortunately, there are lots of them in the market now where you are not sure of how they meet the standard requirements.
Mm-hmm.
Yes, then I just wanted to make a comment regarding the question asked about traveling. If you look at traveling, be it by car, be it by air, be it by train, traveling fails all of those 3 C's of the WHO. So it's a closed environment, it's crowded, and it involves contact. So I think what would make the difference in this case is mask from start to finish, from beginning of journey to end of journey. Most of these masks are known to be most efficient in the first 3 hours. So I would suggest if you can change them, I mean, the common masks we find around, statistics show that they work for 3 hours, after which they are not so good. So if you're doing a long journey, I would suggest you travel with enough masks so as to be able to change them every 3 hours. Yeah. My job involves traveling a lot for when we go on organ retrievals. So the changes we've made is that not more than 4 people on the same van. Everybody puts on a mask, and the driver puts the air conditioner really full blast. It's really cold because that helps to keep the air moving. And yeah, evidence has shown that it reduces, droplets in the air. So yeah, those are the things I would suggest for traveling. Yeah, be it plane, vehicle, or train.
Thanks so much, Dr. Ngassa. And also just to add to what Dr. Ngassa has said, we had a webinar a few months back on traveling. It'll be on our website, and it'll be on our YouTube page as well. If you can visit that and listen to it, we had Dr. Mike Fonso, who works for the aviation industry as well, giving us some tips about how to be safe when you're traveling on the plane. So that can also add to the information that we're sharing here today. Good. just so we also be clear for those who had the COVID before, there's evidence now that people are getting reinfection. So as we said before, you're not immune. Some people are getting the infection. That's still something that we're not quite sure yet. So it is important that the message we're bringing here today is prevention message. And though you also, as Dr. Morgan has said, can get yourself ready for COVID. And we also are worried about long COVID. So we're saying to our community, if you still have any symptoms, please get in touch with your doctors. If there are any concerns, our website has got a link to contact us, and we can always take that information, pass around, and allocate one or two of us to work on it and speak on your behalf. And it's hoping that we'll be able to build this community stronger and also collaborate with our colleagues all across the globe. As I said, COVID has opened up the avenue for us to now partnership and collaborate with colleagues all across the world, and to see how best we can drive and deliver services to our communities. Is there anything else anybody wants to add? I'm conscious that we're coming close to the time.
Just on the matter of collaboration, it would be very remiss of us if we did not acknowledge Dr. Peter Louis Ndifo, a very highly esteemed member of our community, our medical community, who has signed in from Cameroon. Thank you very much, Dr. Ndifo. We appreciate you, and we appreciate also you appreciating us. Thank you.
Thank you. I can see my very good friend, Constant Mumbalam Bonmi. Thanks so much for attending. It's been a good attendance today. I'm so impressed. Thanks so much for signing up.
Thank you very much, everybody. It's been really great sharing our experiences with you.
Yeah, I mean, at one point I saw 52 participants. That's the highest I saw. Maybe Linda saw even better than that. I mean,
yes.
At the beginning it was 19, and I said, okay, that's already a good number. Then
we're also doing we're also doing YouTube Live, so there are quite a few people watching on YouTube as well.
So thank you so much.
So the essence,
thank you, everybody.
The essence here, guys, is to take this conversation and build it into something more concrete. And so I'm so grateful that you guys turned up. I'm going to let the ladies say a few words before I close the show.
Well, thank you all for attending, and I was riveted, I was gripped, and what really struck me was the fact that as doctors we still think, we tell our patients, why didn't you come sooner? And we have symptoms and sometimes we ignore them. So we're all human, and I hope that I'm sure that the attendees have seen that side to us as well, and seeing that they can learn from your experiences, then that would be really useful.
Thank you very much.
So thanks everybody.
Bye everybody. Thank you.
Okay.
Give a feedback for us on our survey, so we know how to best deliver some of these webinars to the community.